Hello everyone, my name is Dr. Akriti Gupta. I am a gynecologist and an IVF specialist. Today I'm going to talk on a very important scenario which is going on in the country, COVID-19 and its consequences in pregnancy. So the first question that arises in the minds of women who are trying for pregnancy this time is that whether pregnant ladies are at increased risk of COVID-19, or is it similar, it is higher than the non-pregnant ladies, and what is the percentage of risk involved. So I must tell you all that the percentage of risk involved in women who are pregnant is the same as that in non-pregnant ladies. However, the severity of the disease can definitely be higher. Second thing is, which is troubling every woman who is pregnant, is that how to carry on the pregnancy schedules, which, for example, include her ultrasound examination or her routine physical examination or her investigations or blood tests, for example. So, how to carry on those if she becomes COVID positive? She won't be able to consult the doctor, she won't be able to go to a regular OPD or to the hospital for that reasons. So, no need to panic. If you are pregnant and you have a gynecologist, are you seeing a person in private, you can contact her in person on phone, book a teleconsult with her, and then she will advise you that if it is really very important to visit the hospital with your COVID positive status, or any of these investigations or your ultrasound examination can be postponed to the next 15 days. Next, third question arises that if a pregnant lady is having COVID-19, how is she going to manage it? So, if a pregnant lady gets COVID-19, so she has to first of all do the following four things: self isolate herself. Second has to be she has to book a teleconsult with her gynecologist and a physician. Third, she has to have self monitoring at home, and then for that she needs these following things. Number one, she needs a thermometer, and number two, she needs a pulse oximeter. So then, how frequently she has to monitor? We have to categorize a pregnant lady into mild, moderate, and severe as per the symptomatology of the disease. Once she discusses her symptoms with the physician on phone on a teleconsult, the consult after that, he or she will label her into the category of mild, moderate, or severe COVID-19. Accordingly, the management will proceed. As for now, home management can be managed for mild cases of COVID-19. These include patients who have a maintained SpO2 of more than 94 at room air, and they have fever, and fever is there which can be managed with simple paracetamol, and they have minor symptoms like body aches or malaise and diarrhea, abdominal pain. So, if any of these, for the woman is falling into the mild category of COVID-19 symptoms, she will definitely be managed at home. For that, she must keep in hand a thermometer and a pulse oximeter. Monitor at least twice her temperature in a day, in the morning and the evening, and if she's noting a rise in temperature, she has to take paracetamol. And paracetamol, which brands can be taken? Simple Calpol, Dolo, and then comes the role of pulse oximeter. I want to make a few things very clear that the use of pulse oximeter has to be learnt. It has to be studied first. You should know how actually you are using the pulse oximeter. You should use it in an exact proper way to get the exact reading. So keep it for 1 to 2 minutes when you switch it on. So give it time to stabilize itself. The next reading has to be taken, and make sure that your index finger is fully inserted into the pulse oximeter. Lastly, make sure that you don't have a nail paint on your finger, because then the false reading comes. So these things have to be very important once you're using a pulse oximeter, and always use it once the reading stabilizes on it after you start it. Fourth thing you should do at home is that you need to take precautions so that the virus is not transmitted to the other people. So for that, you have to self-isolate as you did. You have to be cautious about the things which you are using, and repeatedly washing your hands, and not mixing your plates, your towels, or your daily wearing clothes, washing it separately. Don't mix it with the routine household activity. Next, we are going to talk about the warning signs you must be aware of. The temperature is going beyond 100 degrees Fahrenheit and is lasting for more than 3 days. Second, if your saturation is following less than 94 and it is between 91 to 94% at room air. Third, if you have symptoms like breathlessness and chest pain. So any of these, if you feel you are facing, you have to immediately consult a doctor and ask whether you need to visit the hospital. So these category of symptoms usually fall into the severe category, and then you need to go to the hospital for admission. Talking about the medicines to be used during pregnancy. At home, if you are filing in the category of a mild COVID-19, I told you that paracetamol in the form of Calpol or for that matter Dolo is Crocin is safe. And secondly, you should maintain a good hydration. Plus, you have to, if in case you feel that there are so many drugs that are available in the market, whether you have to use it or not, so it's a strict no. Don't take any drug without any prescription of a physician or discussion with your physician, whether that's on call or whether to see the doctor in person. So the hydrochloroquine use, the use of ivermectin, these are actually contraindicated in pregnancy. So there are no benefits of use of these two drugs with a COVID-19 patient. Then talking about the drugs like higher steroids actually which can be used during pregnancy. We all know dexamethasone is safe, and this is for, you can also use methylprednisolone after the consultation with your physician. The use of remdesivir, which is an antiviral drug, is actually not advised at home during mild cases. It is an IV drug and it has only to be used in the hospital under the supervision of a doctor. So don't take remdesivir at home just for the sake of taking it. It is totally wrong to take any such IV medication at home with due panic. Only because of panic, if you are taking it, just stop it. Besides antiviral, we have antibiotics. The use of azithromycin is quite prevalent. The use of azithromycin is recommended during pregnancy. It's considered safe, and only if your physician is prescribing you that drug, you should take it. So this was all about the pregnancy and COVID-19 and how we are going to manage it. So first and foremost, priority is not to panic, and then consult your doctor. And if you fall in the category of a mild COVID-19 symptoms, you have to manage yourself at home and keep your family protected and prevent the transmission of the virus from you to the other members of your family. I would like to tell few things about the delivery, whether it is safe to get a normal delivery or whether a cesarean only has to be planned. So now, last year, since the preparedness of people was less, so you would have heard that there are a lot of patients, pregnant ladies, who are going for a cesarean section, and many nursing homes and even the government hospitals were taking up the pregnant women into cesarean section. But now the hospitals are actually prepared, and they have the preparedness has increased, and they know how to manage a patient if she comes in normal labor. So normal labor patients with COVID-19 are being accepted. Even if there are medical reasons for obstetrical reasons for a cesarean can also be planned. So both the modes of delivery are safe. Another thing is, after the delivery of the baby, whether to breastfeed the baby, whether the woman is COVID-19 positive and she has to breastfeed or not. This is also another very important question to be taken care of. This basically the breast milk contains a lot of good immunoboosters, and they need to be transferred to the baby through the milk. So if you deprive your baby of these things, how will the baby fight? So breastfeeding is not contraindicated in a COVID-19 patient, and only the precaution she has to take is she has to wear a proper mask and double mask. She has to wash her hands regularly, sanitize her hands before every breastfeed, and if she has a cough or something, since she's wearing a mask, she's safe. So while in the breast milk, the virus won't go. It is only the antibodies which are being formed in your body which might be transmitted to the baby, and it would be actually helpful for the baby in future. So I hope you like this session, and thank you.